Good morning. I'm Shauna Reilly from the Northern Kentucky Forum, and thank you for joining us for this morning's really exciting panel on caregivers and mental health care for our older residents. Last month, Northern Kentucky Forum and Link NKY partnered on a conversation around youth mental health. And so we thought this was a natural outbringing that we haven't maybe talked about as much in our communities. And so this was a sort of the motivation behind today's panel. So I have 4 panelists with us today. I'm going to ask some starting questions, and then we'll have folks, if anyone's interested, just let me know. We'll add some questions. For those who are joining us online, please submit your questions to the chat, and we'll also ask those. So to introduce our panelists, we'll start on the end with Cheryl Bolender from Meals on Wheels, Southwest Ohio and Northern Kentucky. Cheryl is the Senior Manager of Senior Services. That's a lot of seniors.
Yes, seniors.
At Meals on Wheels. And she's focused on social services and mental health services for most of her career. Next is Janet Brewer. Janet is a local resident of Northern Kentucky and has been a caregiver for her mother who struggles with dementia. Next, we have Dr. Suk-hee Kim. Suk-hee Kim is a new professor, full professor, as of last week, we're going to say full professor, so yay, at the School of Social Work here at NKU. She's also on the Council for Social Work Education Board of Directors, and her research focuses on gerontology, but also opioid addiction. And finally, Dr. Katherina Nikzad-Terhune. It's funny when you email people, you know their names really well until you get to pronounce them. I'm so sorry.
It's okay.
She holds a Master in Social Work and a PhD in Gerontology and is an Associate Professor at NKU. She teaches and researches around mental health and aging and mental health impacts of dementia, caregiving, and gerontology literacy. Please welcome our panelists. So when we think about sort of our starting question, what do you think are the most pressing needs in our community to support our caregivers and our folks in their later years, and how they sort of interact in our community, and what supports we could do to or provide in a better way? I will leave that open to anyone, but Suk-hee, if you want, you look ready to go. So
I appreciate that question, and thank you for the opportunity here this morning. Such a great to have this conversation that I believe that most need is the good quality of communication and listener, which our citizens and everyone, even children, need somebody to listen what they have. So I will go with the quality of communication and be able to listen people's stories, challenges, successes. So I will just live with that.
Okay.
Yeah.
I think that's probably the greatest need that seniors have. We're getting more and more referrals of folks who absolutely have no one to support them, or the family member that they do have is at their wit's end when they call us that I have to have a break, I can't do this anymore. And there's a woman that does, her work is primarily in the field of mental illness, but her pushback to everyone when they say, I'm just so frustrated, I don't know what to say, I don't know what to do, she says, just be quiet, listen. So my takeaway from Mary Moeller's trainings is just be quiet and listen. And Teepa Snow says to look for what they're not saying, look at their behaviors that they're doing. People get frustrated because the person is up and cleaning, and that person's whole life may have been spent doing that activity. So the suggestion is do it alongside them. Think of something for them to do that will capture that strength so that they can continue to engage with you. So from Teepa's perspective, listening to both what they're saying and not saying. If they're wandering around saying, I want my mom, and mom's been dead for 20 years, you have to figure out why. You know, what is the need that mom is going to address so that you can meet the need and get them back in their wise mind as much as possible to move forward in the relationship. So.
I think people come both to caregiving and to aging with a lot of different factors there. Personality, because as we get older, we become more of who we were, and sometimes that helps equip you for aging, and sometimes it does not. And sometimes you have interests that will carry you through, and sometimes your interests are no longer accessible to you. So there's that. I think also you mentioned support. People who are caregivers in lots of different situations. Just in northern Kentucky, as you move further and further away from the river, you move further and further away from a lot of support. And it's just, you cannot be everything to every person. You cannot even be everything to the one person that you're taking care of. So you've got to give yourself a little grace if you're the caregiver. But you really need both respite, but also just support in day-to-day caregiving to know I'm doing the best I can. Is this enough? Because caregiving, requires a lot of different skills, and you may have them, and you may have to find someone else who can help you with those. The aloneness of caregiving, or the aloneness of an older person living out in the country by yourself, or even in the city by yourself, is really a big problem.
What could families and communities do to create sort of more, to advocate for more supports, to make sure that there are access to those things, whether they're urban or rural? Is there a piece that the community can do to fill those gaps?
I'll add to that. So I think we can start at a grassroots level too. So we've got kind of the larger issue, which is policy and advocacy for caregivers for older adults. But I think a lot of agencies can come together and say, who are the people that we are serving? Are we asking the right questions? Do we know who's in a caregiving role? Chances are they don't. So maybe start with asking the right questions. Let's find out who our people are, what their needs are. Oftentimes caregiving flies under the radar because people aren't openly talking about it. It can be very enriching, but also very isolating. So asking the right questions, finding out who are our people and what are their needs. And from there, building support services, even if it's just something like what we're doing today, putting together a panel and talking about it and coming together and bringing our expertise. And on a larger level, I know advocacy can seem scary sometimes, intimidating, like so much bigger than me, where do I start? So finding organizations that have a strong legislative reach already, like the Alzheimer's Association, like NAMI, like AARP, that already do the work for us, but we can still get involved and they make it easy. So if there's something you feel like, hey, we really need more of this, or we need to advocate for this, or that we're in danger of losing this, connect with those organizations that already have a strong legislative reach so that you can get involved, and they do make it simple for you.
And I do know that NCAD, the ad district, on their website, you can actually communicate with them. And if you send in questions or send in, I'd like to see this, they will respond. So.
Well, I think that's true.
Yeah.
But you've got to know that they exist,
Right.
and get on the computer.
Yeah.
While you're doing, a million other things. So I really think that looking at what kinds of support is available just in communities that really, the things like churches and social groups and the senior centers, the kinds of outreach places that can sort of tap into, or can know who the people are who are in need, to help them get in touch with those organizations. Because how many people if you take a big survey, how many people over 70 know about NKADD?
Yeah.
So I think it's those things that are already in the community, those branches that organizations need to educate. Yeah, there's an Alzheimer's association, but how do I find them?
And if you do find them, what do they do
Yes.
for you?
Right.
A little known gem in the Cincinnati, Northern Kentucky area is a group called the Music and Wellness Coalition.
Mm-hmm.
And they do events in libraries, in senior centers, to bring music to seniors. And the data is pretty compelling of reaching that senior through music. They'll remember things that they haven't ever been able to kind of focus in on and remember. And on Sunday afternoons now at their base office over at St. Mary's Convent in Cincinnati, they do a Heart Rhythms group, and it's free and open to the public. You don't have to be able to drum at all. The idea is those patterns of doing help tap into places in the brain that have been understimulated, and it's for caregivers, it's for anybody. It's probably my favorite conference that I go to once a year. And I told my administrative assistant yesterday, I'm really sad. I'm going to St. John's in September, and it's the week that the conference is happening, so I'm going to miss it for the first time ever. And so they do the Clavinova groups in nursing homes and senior centers. So go to their website, and it'll have lots and lots of information about their events.
Would you say that the name of them again, please?
The Music and Wellness Coalition.
Now, Cheryl, before we got started, you were talking a little bit about Meals on Wheels and some of your services. I wonder if you could talk about some of the trends you've seen over the last few years when it comes to seniors and meals.
With seniors and the hit of the pandemic, the level of social isolation has just gone up triple-fold. So we actually have a group of volunteers that their specific job is to make, it's called friendly callers, and they get matched with a senior who is socially isolated, and they make calls to that senior on a regular basis just to talk, just to chit-chat, see how they're doing, so that there's one more person that can provide a lifeline for that senior. We do provide home-delivered meals in an 8-county area for Northern Kentucky because we're the only in-person meal delivery service in Northern Kentucky. And last year, between our 5 counties in Ohio and 8 in Northern Kentucky, we delivered over 1 million meals to seniors. And for us, it's more than a meal. It's a social contact, it's a touch base with those care providers, provide enough nutritious meal that the individual can actually get 2 meals a day out of it if they select their snacks well, because you can get cereal, we always give milk, there's always fruit, peanut butter crackers, and along with the hot meal for them to heat up. Primarily, we deliver meals in 5 or 7 day boxes, but we do, with doctor's orders, do daily deliveries to seniors who are unable to heat that meal up for themselves, so that delivery person would actually go into their home, heat it up, get it served to them before they leave. For the 7 of us social workers, those transportation aides and the home delivered meal aides are our eyes and ears, because they're in the home, they see what's going on. They'll call to talk with us and process, this is what's happening, what might we be able to do to help. So while we don't do social services in Northern Kentucky because there's no funding on this side of the bridge for us to have social workers over here, I get lots of calls from our home delivered meals folks on this side of the bridge for us to problem solve and look at where they might go to get assistance.
Now, Suk-hee, you've worked in Golden Towers for some time with the folks in Golden Towers, correct?
Yes.
I wonder if you could talk a little bit about the caregiving needs and sort of mental health resources that are available to folks who are in those types of communities.
Yes, the Golden Tower, actually our NKU students heavily involved with that site. That the residents at the Golden Tower, actually there are many different needs that we were able to observe and also interact with them, that we learn from them very much so. The two significant gaps that our student and myself and also the Golden Tower acknowledge is about the loneliness and not being able to connect one and another. They live there and they do not know each other. So some type of the programs that landing in that place and be able to gather people, first of all, that is going to be a great, and that was a awesome way to linking between the people to people. And also that is the way that we hear about challenges from each other, and also what are the good things that are happening in their lives. So one of the things was that social isolations. Even though they see each other, but there are no other ways to connect one and another unless we have some programs, services place, and also keep on advocating them to be able to connect one and another so that they don't have to stay with a burden for themselves, even though they can say it's a really private for me to not being able to share. But surprisingly, we know that everybody struggle with the same or similar issues. So we see some social isolation within the Golden Tower, and also not being able to access to the services. For example, nearby the Golden Tower has a beautiful library available. They used to go to the library before COVID-19 as an example. But you can imagine people not able to walk and they have no transportation. So earlier, I really appreciate the way that we actually talk about the accessibility of the services. Not only knowing the services, but access to the services are another challenges that the Golden Tower express. So our students at NKU, that through my course that we create a space for actually Golden Tower Library on house, in the place, and be able to use and enjoy that space, that they don't have to go other places, although they could, but that it's accessible. They can read the books in a little bit of quiet places. As a one example of several programs that we was so honored to share. And I still miss the Golden Tower project. That project actually known in the nation. And that we are not continuing right now, but the knowing about our community needs is such an incredible. And also our NKU students, which our social work program students were able to very engage with the Golden Tower residents and staff members, that all of them, I believed that they have awesome experiential learning, service learning experience through that opportunities. So I appreciate the question that you bring into this table.
In the Cincinnati area, I have social workers that are actually attached to some of the senior buildings. It's through a grant from Housing and Urban Development, which is, once again, at the federal level, none of those contracts have been signed yet. So we're on pins and needles as to whether we'll be able to continue to have social workers and aides embedded in those buildings. And it truly depends on the creativity of the person who's doing that job to listen, look at what the needs of that community are, and grow programs. So they invite folks to come in to talk about topics. They do bingo together. They once tried to not do bingo, and that service coordinator was not well received. Bingo is very, very important. So they looked at how to do bingo with the questions and things being nutrition bingo, or services bingo, where on the cards it would have information about things they could do in the community. At one of our buildings at Cambridge Arms, the social worker that I hired that works there also has an associate's degree in nutrition. And she partnered with, reached out to the Free Store and partnered with them, and we have a fresh produce market that actually comes to those buildings in the warmer months and sets up to have the seniors be able to get free, fresh produce to, again, nutrition is our anchor. So she brought herself to the table with those seniors and talked about what could be done, because the Free Store had reached their capacity on delivery of fresh produce boxes, and the only way around that was to look at whether they could deliver the stuff in bulk, and then the seniors could come down like you're going to a farmer's market and pick out what they wanted to take with. And then at the end of the day, one of the volunteers that works with us from DD Services, her church comes and picks up what's left, because you can't have any leftovers. You can't send it back. So, and that goes out to a church to further serve the needs of the community. So
it's interesting you talk about nutrition. My grandfather became a caregiver at 80. His wife had a stroke, and he had to learn how to cook. He'd never cooked in his 80 years. We should all be so lucky, perhaps. But he had to learn how to cook to make sure that she could stay at home and all of those things. Yeah. And so he was learning nutrition, and he cooked what I would consider a very exciting meal for him. So like there was vegetables, there was protein, there was carbs, and he did it every night. Like this was my goal, to keep her out of the hospital. So it was kind of interesting to think about the nutrition needs that folks like, well, you've cooked for years, this should be fine. Not everybody has. And so just thinking about this, the different perspective.
And kind of how you ask the questions too, because all of us as adults want to say, oh yeah, I know how to do that. But when you're doing a screening to see if somebody needs a service, you don't ask yes/no questions. If they say they can cook, you ask, well, what's your favorite thing to cook? Tell me how you would do that, because that's where you may see that there's some breakdown and that there would be the need for them to get nutrition brought in addition to what they may or may not be able to do for themselves.
And I've found that through my caregiving research and having conversations with caregivers, surveying them, there are quite a few caregivers who don't even identify as a caregiver. So for example, I remember talking to a woman, they'd been married for decades, and she was in, by my standards, by our standards as professionals, full primary caregiving role, doing it all the activities of daily living, the feeding, the bathing, the toileting, all of it. And I remember her saying, well, I don't consider myself a caregiver, I'm just a wife. This is what I vowed to do. And I thought that was so interesting. And I've seen it on the other end too, where people, they really minimize their role. Well, all I do is take my grandpa to the doctor a couple times a week. Am I a caregiver? And I'll say, absolutely, you're a caregiver. So when you have individuals on the caregiving spectrum who don't know they're in a caregiving role or identify as a caregiver, chances are they're not reaching out for support or even know to look for caregiving support. So I think that's important for all of us to remember too. And again, it goes back to asking the right questions, right? If they don't identify as that, then they're not going to know what's available to them or seek that.
So Janet, you talked a little bit about the isolation of being a caregiver. And I know this is a particularly strange question, but what do you need, or what did you need to be able to continue in that role, to get that social interaction, the support you needed?
Well, first of all, let me say I was not the primary caregiver for my mother. My sister lived with her and took care of her, and took excellent care of her. And she lived not in northern Kentucky, but down in central Kentucky, out in the country. And she had moved there from her job in Philadelphia. So she didn't have her usual, she didn't have the friends that she might have had. And for my mom and dad not to be able to go to church, that meant that she didn't have a community there. So she was really very isolated. So I just, my role really was, I will come take care of Mother. You must leave this farm. You must go somewhere, even if it's just to a coffee shop and read a book, or go to a park and stare into space. You must. That was one of the main things. We also had a number of medical people in our family who were providing medical support, but she was the primary caregiver, and so she really needed to hear from our medical people exactly what they were going to do, because she was the primary caregiver, and not just be passed over by people who come in and take over. And I've heard that with other people, that they're the primary caregiver, but then when an organization comes in or a medical person comes in, they take over and they do not consider the needs of the caregiver in terms of the responsibility that they've been carrying, and that they want to be informed and still make decisions. I think those are a couple of primary things. And it's also good, if you're out there and you know what's going on, to take somebody food. Mm-hmm. That's my thing. Mm-hmm. Take them food.
It sounds like you were the caregiver for the caregiver, and that was really
more my role. But I mean, I could stay with my mother, and I thought I could take perfectly good care of her. But my sister, it made her very, very nervous to leave my mother at all, even with me, or maybe especially with me. But yeah, we really had to just force her to take care of herself.
Now, Katie, you run a program, or you're part of a program called Age Friendly University. I wonder if you could talk a little bit about where that came from and sort of how that contributes to, engaging seniors in different phases of life.
So in 2020, NKU became the first age-friendly university in the state of Kentucky. So Suk-hee and I were part of that initiative, along with Dr. Allison Graff, Amy Danzo, and Sarah Conwell. We were very proud of that distinction, and we decided after that we don't want to just hold this title and not actually live this out. What does it really mean to be an age-friendly university? So we developed the Age-Friendly University Coalition the following year, and the coalition has grown to have representation from faculty, staff, students, and community partners. We might be recruiting you also, be warned. And so we meet monthly to talk about ways to really promote age inclusivity on campus and find ways to support students and faculty of all ages. To be age inclusive isn't just about focusing on the needs of one age over the other, it's focusing on the needs of people of all ages on our campus. So we're a thriving group. We've been able to do a lot of incredible work over the years to support our students and our faculty and staff. We recently did a caregiving study on campus and found that I think sometimes we think of caregivers, we automatically think, well, you're older, like spouse or taking care of an older parent. And there are quite a few caregivers who are 18 years old in a full-time caregiving role for their grandparents or a loved one with special needs. And so we need to know that those people are on our campus, and that affects their day-to-day life. It affects their academics, their ability to finish their degree. And so us as a coalition, we really try to build support services, connect people to the community, so they feel supported in the roles that they have.
Now for the community-facing pieces of those, so we talked a little bit about, well, there's this form you could fill out and get answers, but how do folks find resources? How do they connect with resources? We know there's certainly some in the community, but it's hard to find them. And instead of sitting there and Googling and looking for things that you don't necessarily know where they are, but how do I, as a caregiver, find those resources? And is there a central location for them? Is there a hub? I'm curious as to some sort of resources for us.
That's a good
Well,
question.
there is a senior resource
Guide.
in northern. Well, no, there is a organization
Oh, okay.
in northern Kentucky. whose name I can't remember, that grew out of the work that they were doing at St. Charles.
Okay.
Do you know what I'm talking
Okay.
about? The Senior Resource person.
Senior Resource Center.
Thank
Is that
you.
the name of it? Senior
Okay.
Resource Center?
Okay. And she just has an amazing knowledge of the resources in Northern Kentucky. So that's I typically always send people there. And my husband was a minister, and so often people were coming to him to ask, you know, where do I go or what I do? So he would just ask me, and then I would tell them where you go. That's why I say that there are people out there who are already touching in communication with those people, and if the organizations can help those people, then you're just going to reach people exponentially. But there really is a good resource in Northern Kentucky.
And I'm sure that we all know that the resources are there, just a matter of finding and when you are finding it, when you really most need that time. So NKYDD is one of the hub place to navigating the senior resources, services, programs. They have very comprehensive resources that they are available at any time. It's a matter of contacting them and asking the good and right questions to them. If they cannot deliver or providing such programs and services, they are willing to, and I think that I'm advocating the program, but they are willing to connect the people and connect the program other places as well. And Northern Kentucky has also the Northern Kentucky Aging Council on Aging. We meet once a month, often, but the first week of Thursdays, typically 10 o'clock, and about 1 or 2 hour session that we have it. With that meeting, it's a public and welcoming anybody get into that meeting and learning about, and they are reporting how our citizens are doing in our communities. So with that type of council, that you will be able to access to those service informations and program information as well. Other than that, local or regional aging related forum like today, or a service, or the tables that are available through the different type of events going on related with all the others populations in our Northern Kentucky. There are many, but our unique location here is a tri-state, that we don't have to navigate the services in Northern Kentucky. We could access to the Ohio and Indiana, along with the Kentucky. So we are in a great place to navigating a little bit more beyond the Northern Kentucky resources and programs that if we are looking for too. So I just named a few programs, but there are many different programs that they are. And also our local, one of the strong hospitals is the St. Elizabeth Hospital, that they do have a lot of different services that they are sending to the patient, sending to the patient's family members as well, including caregivers.
I often refer people to the local area agency on aging if there is one available. If they're a veteran, the VA has a lot of caregiving resources, really good resources too that people often don't know about. So I learn a lot from the people I work with too. I didn't know that was available. Now I do. I'm going to add that to my list.
The VA has a specific team that is just for the caregivers now. That,
And I think all those things are really, really good. I think if physicians knew more about what those agencies were, they are touching people. But I'm just going to say that when you're when you're taking care of somebody full time and managing all their bills and all their physical needs, and you can't leave them for very long lest they try to go downstairs to do the laundry. Excuse me. And then you also have to mow 3 acres. and manage the person who's leasing your farm, there's really not much time to research what organizations there are.
Wonderful. Can I add this? Because we cannot pass this, which is Northern Kentucky University. As one program is a School of Social Work. Feel free to reach out to us. We can connect our people in our communities. And sometimes I reached by my coworkers and which is colleagues at NKU, and students reach out. I have this issue. Where should I go find those information and resources? So please don't forget, NKU is a resource for our communities. We have students are such an expert in caregiving, as an example. They have been doing that, and they found great resources as well. So we as a faculty and staff at NKU can link to the communities and meet their needs, and also vice versa. We have resources at NKU on campus. There are many different events going on, which is careers and aging events once a year. Sometimes in March or sometime April, that we have a big, wide open community event at NKU. So feel free to reach out. We do have resources. Just a matter of who is reaching out and the matter of who is going to providing and supply those needs where they are. But surprisingly, I think that, please correct me if I'm wrong, not many people know that local universities is not a resource hub. But I just wanted to encourage everybody, including myself, NKU is a resource for everybody. Because I certainly firmly believe university is belong to our community, and the community belong to our university. Otherwise, we have no connection, no reason to be having the program like we are delivering to our students, skills to develop, and also their career development through our program and curriculums. So I just wanted to highlight that NKU is a resource for everybody. Whatever the resources are and whatever the needs are, that we are willing to connect, also providing if we can.
But to go back to Janet's point, that when you are doing all of these things, there's not really time and space and intellectual space to reach out and say, all right, I need this. And so I think we need to reach out the other way, not have expecting folks to just reach out to us when they need something. It's what do we do proactively to make sure that folks have the supports they need before they go home, before they take those pieces. And if I'm reading, okay. That thinking about sort of what we do proactively to support our folks in their homes so that they can stay there, so that their folks are supported, I think is a critical piece. And so thinking about proactively, what can we do? I mean, as a community member and community members who are interested in supporting folks, we've talked about the volunteers who reach out and call folks to see what's going on, but that's after they've been identified as needing Meals on Wheels. So help me navigate that piece about how do we find the folks that need us the most? And I know that's a big question. Maybe some of the folks in the audience have thoughts too.
I think we have to go to them in their settings where they're comfortable, where they're safe, where we're the guest in their space, and educating and informing, bringing the resources to them, because they're not always going to come to us. They don't always know what they need. Now, and how to do that? How do we go to all these spaces? I don't know the answer to that.
Right.
We start small.
I think I mentioned there are people who are already in communication with a lot of seniors and a lot of caregivers. They are hospice, they are churches. Ministers are sorely uninformed and could be a great resource for people. The senior centers, the quilting groups, the garden societies, all those places. If someone just took a pamphlet to them and said, here, there's a senior resource center. here's a resource for you to give to your people. That's a start. It's not a finished program, but it's a start. I'm curious now, the next time I go to the doctor, I'm going to ask my physician what resources she has to recommend to me.
We are having this, which I really agree with what you have shared, that we are having this wonderful forum here at the library. And oftentimes, all of the service providers wanting to display the available services and be able to communicate that services and information through the library, as far as I understand, for a number of years. So I'm really grateful for having those conversations at the library side. Oftentimes, different site to site, the library have their resources be able to provide for people who are asking, but the proactively reaching out to them is another critical approach to that. What I wanted to share along with that line is that we actually very comfortable to finding program and services and policy based on healthcare providers' perspective. But we needed to invite the service users, sometimes we call that clients, and service recipients, that they needed to be on the table, like today, that we needed to hear about them. Because service providers, yes, they are experts. Maybe we miss a whole and big important aspect if we do not proactively reaching out to them. Let us know what your needs are instead of this is what we have. Would you like to have them? That's a good suggestion, but we needed to do more, proactively inviting them to the table. Teach us what your needs are. What are your caregiver struggles are? And then we as advocator to advocate to the medical team. And I do know that they are very willing to listen. It's just a matter of how we approach to it. But so far, based on my knowledge and my experience, is that a lot of the time make a decision about program and services with the provider's perspective. But how many programs actually implementing that conversation with the service users, caregivers, clients, and service recipients? So I just wanted to make a note to that, to myself actually. I need to hear. I teach at NKY. I often miss my students' needs because instructor giving them guidance and forgot about their needs, their learning styles. So I just wanted to give it that thought, and I thought that's really a good, important aspect to value and honor our service users, service recipients, our citizens' voice that oftentimes we forgot. So that's what I wanted to share.
Do any of our audience members have questions or comments that they would like to share as well? Happy to keep going, but I know that you all came for a reason. So if there was a question that you all might want, and our folks online, if you have questions as well, we're happy to answer those.
If I could just
Sure.
touch on one thing. You were talking about the library. So libraries have some programs that are really directed at seniors, but I would not be offended to go to a program from the Historical Society and meet someone there who had a little table giving me pamphlets on the Senior Resource Center. It's not what I came for. I came for the snappy pizza and the and the program. But I mean, that is often a room full of people. They're just places to touch people if we look for them. And the library is a good one.
Yes.
I'm a senior and I'm a caregiver, and it's very expensive for my clients to provide care. Isn't there something on a state level that people can go to with funding?
Funding anchors are usually based on how far above poverty level someone is. So if they have resources, probably the best advice that I could give is before they are in the condition of not being able to sign things and plan for themselves, that they reach out to an elder care attorney to look at how to put funds in trust in order to protect it should they have to go on Medicaid. Because Medicaid is a welfare program, so if you have resources and assets and your income is too high, you won't qualify for that. So
there's a program that you can get for yourself as an individual, extended care type of things. But there's so many people that do not understand or know that those are available. Is there something that can be done as far as advertising that for people who are like under 50, so that they know that they need, well, probably younger than that, because I think it's based on age or another premium. And I'm finding that my clients individually have all said that if they knew that there was some sort of a service out there, like your life insurance, if they knew that there was a program that would support that they would have funded that many years ago, so that now they would have the funding in order to have care of them.
Are you talking about long-term care insurance?
long-term care insurance, yeah.
Yeah.
I personally have that, so I know that.
Yeah,
It's not cheap either.
No,
When
no.
I get to the point where I think I can take care of myself, at least I have a venue that I can go with. And it's,
Right.
it's not all out of pocket. My mother was on Medicaid, thank God, when she needed care. She had like a very good place. Things got very easy with Medicaid, but Medicare doesn't seem like that they provide any financial help other than the medical part.
Right, that's correct. And Medicare and Medicaid are on the table for being looked at to do some major cuts. And the folks that are going to be hurt the most with the Medicaid looking at things are going to be individuals with childhood disabilities who rely on that money that are in the DD population, and seniors, because the care of seniors in nursing facilities is primarily funded through Medicaid funding.
Right.
So.
I have clients who have grandchildren that are autistic,
Mm-hmm.
and that is a main concern for them. How are they going to take care of them?
Yeah. So, and again, I don't know that elder care groups or that insurance companies do a good job of advertising that their products are available. But when I'm the front door for social services, so when my team gets calls and it's someone, we ask a few asset questions, and it's clear they're not going to qualify to get in the door with us because our funding is all tied to the levy and Medicaid and Title
I know those
III.
are the resources that
Yeah.
are available.
So we spend time then with them saying, you really need to get in touch with Pro Seniors. Call Pro Seniors. They will be able to tell you of an attorney that you can go to and get a free consult, and then you can make some decisions about what you want to do. Or I recommend that people get in touch with the Bar Association. So Cincinnati Bar Association covers just the Cincinnati area, but I know that there's a bar association in Northern Kentucky, and some of those attorneys do some pro bono work, and most attorneys do a free 1-hour consult.
Correct.
So that at least will get a little education going for people to be more planful. So.
May I get on my soapbox for just a minute? To everybody in this room, everybody who is watching, everybody in the world, here's something you can do for your potential caregivers, and that is to have all of your needed paperwork in order, to have a will, to have a medical power of attorney, to have a power of attorney who can pay your bills, because you never know when you're going to break both your legs and end up in the hospital. You may come back out to take care of your things, but for that short period of time, you need a power of attorney. And if you have all of those things set up, it is a great gift to any caregiver who might be taking care of you. And also look at legal aid. Legal aid, I don't know if this is always true, but they will sometimes do wills for free. So Bluegrass Legal Aid is another good resource. But do it. Doesn't matter how old you are.
Right. And do it with durability clauses built in so that you don't ever then have to go before a judge to have someone appointed as your legal guardian, because you've already got in place what's needed for someone to make the decisions in case of your continued disability. So one of the other products that we do in Cincinnati is that I have social workers and myself. We serve as legal guardians for folks who don't have someone that can do it, or where the family, because our referrals come from Adult Protective Services, the family has been deemed not appropriate to serve as the guardian. So, but on those cases, the person's already slipped to the point that they can't make an informed decision and sign the paperwork, so we have to go to court. Doing work with an elder care attorney to get a durable power of attorney for finance, a durable power of attorney for health care, a living will, and having those all in place, and again, keeping them centralized so that when somebody walks in, they know where to find them, is essential to be able to avoid the court taking over and making the decisions.
It's interesting. I still see patients 1 day a week. I've been a therapist for a long time, and I've had a lot of conversations about wills, advanced directives, doing it now, and not everybody has this reaction, but more than I can count, the fear that if I do it, I'm bringing on my own death or the death of my loved one. There's a lot of fear for some people to move forward with having those documents drawn up, with having those decisions made. So that's something you really just have to be patient with and talk through, and baby steps really to guide them to that. So just wanted to put that out there. I've seen that more often than not.
Well, we're almost out of time. Do you all have any, parting wisdom for folks who are embarking on caregiving, or currently caregivers who are watching remotely because they couldn't be here this morning, people who are looking after the caregivers themselves?
Give yourself grace. Do the best you can and give yourself grace.
Anyone can become a caregiver at any age and any circumstance, and we're seeing more and more of that now. So just encourage people to think ahead. If they're not yet in that full-time caregiving role, but they think they might be in a couple years, do some planning now, mobilize resources now, so that if you have a crisis or an emergency, you're not trying to mobilize resources in the midst of the crisis. So if there is an opportunity to be preventative and mobilize resources now, I do recommend doing that.
Acknowledge their effort and hard work that doesn't take much, but we can say, be kind to them and encourage them. And just simply, I hear you, that must be hard. Maybe that's all it takes. Yes. We may not resolve the issues, but being with that shoe and knowing that somebody really know what I'm going through, and be with that journey. Oftentimes it's a burden, very heavy, but the person doesn't have to carry that whole burden alone. We share the burden together, encourage them, be kind to them, and acknowledge their work. And I think that oftentimes when I do that, people cry, because that's all it takes, because we move their heart. And somebody, oh, know what I'm going through. That's all it takes, I think. I think that will be the very good and first step to be closer to the people who are having very, very tough time in their journey. So I think that can be a beautiful way to embrace our community and individuals and family members.
And I think it goes to grace. It's honor what people have done that have got them through, because it's in looking at what things that they've relied on to get them through that you might be able to find a fit for a service or a support that will be helpful to them.
Well, with honor grace, and love will end today's panel. Thank you all for joining us. Sorry, I couldn't help myself.
It was beautiful. That was beautiful, Shauna. Thank you.
You like it.
Please join me in thanking our panelists.
Thank you.
Oh, thank you. Thank you.
Appreciate you.
Thank you.